Good morning, everyone. I am your student nurse, Judy Ann, and today we will be performing the bed bath procedure. So, before we start the bed bath, we will bring the necessary equipment first to the bedside so that we can conserve time and energy. Right after that, we will be reviewing the chart for any limitation in physical activity so that we can identify the limitation to prevent the client discomfort and injury. Now that we are done reviewing the chart, we can now perform the hand hygiene and put on some gloves or any other PPE if indicated. This is to prevent the transmission of microorganisms. So after this, we will identify the client and explain the procedure. And now we will be closing the curtains to provide some privacy. And now we will remove the anti-embolism stockings from the lower extremities according to the agency protocol. So before we proceed to the bed bath, we will be offering the patient bed pan or urinal. And now we will be removing the gloves and perform hand hygiene. And now we will adjust the bed to a comfortable working height. Usually it is elbow height or the of the caregiver. Having the bed at the proper height, it prevents the back and muscle strain. Now we will lower the rails and put on some gloves. And now we can proceed to the bed bath. First, we'll place the bath blanket over the patient, and after that, we can remove the top sheet while the patient holds the bath blanket in place. The bath blanket serves to not expose unnecessarily, and it is to prevent cold to the client. So now that the client has the bath blanket over, we can now proceed on removing the patient's gown. This tool provides uncluttered access during the bath and maintains warmth of the patient. So here we put a towel across the patient chest and on the top of the blanket. So assume that is a bath or towel. With no cleanser on the washcloth, we can wipe the one eye from the inner part of the eye near the nose to the outer part. Rinse and turn the cloth before washing the other eye. And then we can proceed on bathing the patient face, neck, and ears. And here we will bath the client's forearm. While soaking the client's hand, we will be bathing the near arm. Here we will be washing the abdomen of the client. Now that we are done with the abdomen, we can now expose the leg of the client, but make sure that there are no necessary exposures. Now that we are done with the legs, we will be changing the water. Now we will assist the patients on the sideline position, and we need to make sure that there are no unnecessary exposure of the skin. And now we will be washing her back and her buttocks. And then after that, we will give her a back rub if necessary, or if you are allowed to. And here we will be giving the towel to the client to do the perineal care, since she can move. Now that we are done with the perineal care, I will be helping the patient to put on clean gown and assist with the use of any other personal toiletries. So now, right after this, we will now groom the patient's hair. We will assist the patient to a comfortable position. So now that the side rails are up, we'll be cleaning the equipments that we used, and that's it.